This lecture will guide you through your essential health and safety rights and responsibilities on the job in Ontario, as outlined by the Occupational Health and Safety Act, or OSHA. Understanding these principles is crucial for preventing injuries and illnesses every day at work. It also clarifies what the OSHA expects from your employer and supervisor. Let's begin by understanding the foundation of workplace safety in Ontario, the Occupational Health and Safety Act. The OHSA is a collection of laws that define the duties of employers, supervisors, and workers. It's supported by specific regulations that detail safety requirements for various situations, like handling hazardous materials or working in different industries. The ultimate goal is to prevent work-related injuries and illnesses, with Ministry of Labor inspectors ensuring compliance. Safety is a shared responsibility, but the OHSA assigns duties based on authority. The employer, having the most authority, bears the greatest responsibility for overall workplace safety. This includes informing workers about hazards, ensuring supervisors are trained, creating safety policies, and providing protective equipment. Supervisors are responsible for communicating hazards, enforcing safety procedures, and ensuring proper use of protective equipment. Workers, including you, must follow safety procedures, use protective equipment, work safely, and report any hazards. As a worker, you have critical rights under the OHSA that empower you to stay safe. You have the right to know about all hazards in your workplace and receive proper instruction on how to perform your job safely. It is also your right to speak up and ask questions without fear, especially if you're unsure about how to do a task safely. Crucially, the law protects you from any reprisal, such as punishment or firing, for exercising your OHSA rights or reporting safety concerns. You should never be worried about asking questions. Knowing about potential dangers is your first line of defense. A hazard is anything in the workplace that could cause injury or illness to you or your colleagues. Common hazards include repetitive movements, especially in awkward positions, and risks of slipping, tripping, or falling. Working near machinery or motorized vehicles, and even workplace violence are also significant risks to be aware of. Don't forget less visible hazards, like chemicals, fumes, toxic dust, or biological agents, which can cause illness immediately or years later. There's a hierarchy of controls to protect you from hazards. The best method is to eliminate the hazard entirely, like replacing a toxic chemical with a non-toxic alternative. If elimination isn't possible, engineering controls can reduce exposure, such as improving ventilation or adding machine guards. Administrative controls, like changing work procedures to reduce exposure time, are another way to manage risks. Finally, if hazards still exist, you must use personal protective equipment, or PPE, as required by your employer or the OHSA. Here's a visual representation of the hierarchy of controls. Beyond physical controls, gaining knowledge is crucial for your safety. Your employer must provide written safety procedures for your tasks and equipment and ensure you understand them. You'll also receive specific training on hazardous materials through the Workplace Hazardous Materials Information System, or WHSMIS. For equipment, operators' manuals are vital resources for safe use and hazard identification. Always report any observed hazards or close calls to your supervisor immediately to ensure they can be addressed. Your involvement is key to a truly safe workplace. Participate by asking questions when unsure, especially about safety procedures or hazards. Consider becoming a worker health and safety representative or joining the Joint Health and Safety Committee. These committees inspect the workplace, identify problems, and make recommendations to the employer to improve safety. Always take your safety training seriously and apply what you learn on the job. You can also be a safety role model for others, influencing their practices and fostering a culture of prevention.
If internal channels don't resolve a safety issue, you're not alone. If your employer or supervisor fails to fix a reported problem, you can contact the Ministry of Labor, Training, and Skills Development. They have a toll-free number, 1-877-202-0008, available 24/7, and you can report anonymously. Remember, Reprisals for raising safety concerns are illegal. If this happens, you can file a complaint with the Ontario Labour Relations Board.
One of your most powerful rights is the right to refuse unsafe work. If you have reason to believe your work or equipment might endanger you or a coworker, you can refuse it. You must inform your supervisor and health and safety representative, explaining your concerns. If the problem isn't resolved or you still feel unsafe, a Ministry of Labor inspector will investigate. Note that some workers, like firefighters or police, have limited refusal rights if the danger is inherent to their job or refusing would endanger others. Ontario has a comprehensive health and safety system with several key partners. The Ministry of Labor, Training and Skills Development enforces OHSA and sets training standards. The Workers' Health and Safety Centre provides training, while occupational health clinics for Ontario workers offer medical services. Health and safety associations provide sector-specific consulting and training. Lastly, the Workplace Safety and Insurance Board, or WSIB, administers no-fault workplace insurance. Here's a diagram illustrating the connections between these vital organizations. Now that you understand the fundamentals, your employer will provide job-specific information and training. This includes specific hazards in your workplace, reporting procedures for concerns or injuries, and required protective equipment. You'll also learn about emergency plans, hazardous material information, and workplace violence prevention policies. Always remember, when it comes to your health and safety, there are no silly questions. Asking that question could save your life.